goal
Recording
is to
in
help
progress.
our communities understand our situation with COVID-19, mandates that have been put into place through federal and state governments, and how they impact you. Should you have any personal concerns and questions in regards to the COVID vaccine, your best source of information is your primary care physician. Our public health continues to focus on vaccine adoption by all eligible members of our community. And be assured that our shared Department of Health is focused, laser-like, on each person in our area, especially Genesee and Orleans counties. Every person matters. Today I'm joined by Matt Landers, our Genesee County Manager, and a new participant, Jack Welch, the Orleans County Manager, and a very familiar face and voice, Paul Pettit, our Public Health Director for Genesee and Orleans counties. With that, Matt, take it away.
Hi, Shelley. Thanks a lot. So it's been a little while since our last press conference, I believe June, and I will admit I was hopeful that maybe we wouldn't need another one of these based on the trending that we were seeing back in June. But unfortunately, here we are. We are reunited once again. We will continue to hold these as often as needed as we did in the past. Hopefully, we won't need a lot of these, but I want to thank the press for joining us today. And I will make this very brief so we can get closer to letting Paul give us all the updates and the pertinent information so that our local residents have all the information they need. But as Shelley said, that there's other avenues for getting this information. We definitely want to be able to be as transparent and open and pass along the information that we have so that people can make the decisions that they need to make. We just held a recent appreciation luncheon for all of our wonderful volunteers in Genesee and Orleans counties here at GCC. Great turnout. It was great to see so many faces that gave so much of their time. Paul kiddingly said that, get ready, we may need you again. And unfortunately, it's looking more and more like that may be a reality. So hopefully they take that to heart. And if we do make the call, hopefully everyone can answer the call again if we have to re-stand up some of these clinics over at a site like GCC. Genesee County, and I'm sure the same is for Orleans County, we are committed to vaccinating everyone that wants to be vaccinated. We will take the efforts necessary to complete this process, and I know that Paul and his crew have been doing an amazing job of not only having access to the vaccine, but also testing. Not every county can say that, but there's been a continued effort to allow for testing at least once a week here at Genesee County over at the health department. And I've been glad to be able to see that continued effort continue on even during these lower periods of positivity that we had throughout the summer. At this point in time, Jack, I wasn't sure if you wanted to say a few words for Orleans County before we dive into our own Dr. Fauci, like Paul Pettit, who he gives his updates. So I'll turn it over to Jack if you have a few comments. Oh, the mute mouse, I gotcha.
Yes, thanks, Matt. Orleans County is Genesee County. We appreciate all that our public health health department does for each of us in our residents. And if it wasn't for them, we wouldn't be able to provide the services that we are able to provide at the time and point when people feel comfortable to obtain the vaccine. So that's the most important thing, I think, is when people are ready, we will have our vaccine clinics available for you. We're not trying to push you into it, but when you're ready, we're more than willing to help you become vaccinated. So we appreciate your patience with the approval process from the federal government on those vaccines, and we're ready here to serve. So with that, Paul.
All right. Thanks, Jack. Thanks, Matt. Shelley. Yes, we are back together again, doing these press briefings. And as Matt mentioned, we were hoping that we didn't necessarily have to do any more of these, But the reality is COVID is still lingering and the pandemic is still active. And we are still in a very active response mode to that. And what I plan to do today is very typical of what we've done at the past ones, where we're going to go through some data, kind of current snapshot of where we're at. We'll look at some vaccination rates, some different local things that are going on here in Genesee and Orleans County. And then obviously we'll open it up to questions and answers to the press at the end, obviously to try to get you any information you may be looking for. In addition, I do have my PIOs, educators on right now, so they will do their thing while I'm talking and throw up different links in the chat. So if you're recording and or you need the links to post, on your end, feel free to do that. So as we get going, again, Matt mentioned we did do our appreciation luncheon, and again, that was a great opportunity to recognize our staff, county staff, but in addition to the many, many volunteers, over 450 between Genesee and Orleans County, that have given of their time to either provide services at our testing clinics and or at our vaccination clinics in both counties in some cases. So it's truly a large effort when you think of the amount of folks that have come forward and provided those vaccines and different tests. And again, as Matt mentioned, we're going to be calling some of those folks back up soon as testing and vaccine demands increase here heading into the fall. So with that said, also just again want to recognize my staff back at the health departments who are doing great work in both counties. I'll be remiss if I do not do this. And, bottom line, they are working behind the scenes. They are doing the case investigations. They're working at the testing clinics, providing vaccinations on a daily basis to our residents in both counties. And I just want to thank them for the hard work and continued dedication to all of our residents as they continue through this pandemic. All right, so looking at some data, just in general, we have been experiencing an overall upward trend in positivity rates and COVID spread in both of our counties. We really started to see this increase late July, early August. We had a couple month reprieve where we were seeing very, very low positivity rates, and we'd go a week with only 1 or 2 cases. Unfortunately, that did change again late July, early August. Data is showing currently that we are seeing increases in active cases in all age groups. So again, children, young adults, seniors, we are seeing current cases across the board. We do know that the Delta variant is likely the cause of that. We have isolated that strain Delta in both counties, Genesee and Orleans. So we know it's here, and it is presumed that the majority of the cases now, although we don't obviously check to see what strain or variant each case is, we do know that Delta's here and more than likely driving those cases right now. We also know that the majority of the cases are in the unvaccinated. We have seen an increase, again, over the past few weeks of vaccinated folks getting COVID. And again, this is directly tied and coincides the data we're seeing nationally and around the state regarding the Delta variant. And we'll share a little bit more on some of those numbers, but we're seeing around 20 to 30% of our cases over the last month are in the vaccinated population. So quick snapshot, Genesee County, 5,615 total positive cases to date since the start of the pandemic. We currently are sitting at 77 active cases. We have 15 in the hospital of those 77 active. We have 4,947 recovered. And again, that means removed from isolation. After 10 days, we remove them, from our care anyway, so to speak, overseeing that. There's been 124 deaths in Genesee County, unfortunately, since the start of COVID. And our current COVID tracker, again, from the State Department of Health, 7-day average is at about 5.8% positivity. So over that 7-day average, we've had 114 positives out of 1,955 tested. All right, jumping over to Orleans, we're at 3,304 total positives, 64 active cases with 2 in the hospital. So a little bit numbers on the hospitalization side in Orleans County. 2,844 recovered. 83 deaths, again, since the beginning of the pandemic related to COVID. And again, looking at our positivity rate in Orleans County, we're sitting at 5.3%. Over the last 7 days, we've had 55 positive tests out of 1,039 folks that have been tested. So when you look at 5.3, 5.8, we're slightly above the Finger Lakes average as far as positivity, but pretty much, again, in line with what we're seeing, around the state. All right, so one thing that we've talked about is COVID breakthroughs. So again, how many folks are vaccinated versus unvaccinated with cases. And just real quickly, I want to provide a little bit of data on that for folks. And again, this is basically covering the month of August. We didn't really go back beyond that because our cases were really still pretty small, as I've mentioned before that date. But in Genesee County, we've had 253 cases in August, since August 1st to date. There were 78 individuals who were fully vaccinated, 175 individuals who were not fully vaccinated or unknown status in some cases. So that puts us around 30.8% breakthrough cases of fully vaccinated in Genesee County. In Orleans County, we had 199 new cases since August 1st. 34 of those, again, were fully vaccinated. 165 were not fully vaccinated or unknown. So our case in Orleans County is 17.1% breakthrough for those that are fully vaccinated. And again, those numbers are really right in the ballpark of what we've seen with the Delta variant around the state and around the country. It is hitting those that are fully vaccinated a little bit more than the original 1.0, which is what we're seeing here locally. The good news is, again, the vaccine is working. Although there may be more folks getting COVID, it's not severe. They're mainly asymptomatic, and there's not a lot of symptoms that are going along with that or severe symptoms. So it is working and preventing people from getting really sick, and overall, it's really keeping people out of the hospital and dying. So again, really supports the case to get more folks vaccinated, as many as we can. All right, so jumping over to just the vaccine update, as I just mentioned, vaccines do protect people against severe illness and death, and we are seeing that with the new Delta strain, and hopefully if other variants come to be, they are providing protection against infection and getting the virus. Overall, the COVID-19 vaccines significantly reduce the likelihood of hospitalizations and death. And again, the best way that we've seen is to slow the spread and reduce the infection is to get people vaccinated, which is why we're really spending a lot of time educating, talking about getting vaccinated, talking about the safety of the vaccines. Obviously, we now have a fully approved FDA vaccine in the Pfizer, which, again, will hopefully reassure some of those folks that were waiting for that full FDA approval before they went and got vaccinated that, the vaccine is safe. It's been studied. They've looked at all these vaccinations that we've given around the country over the last 8 months or so, and, it has proven to be safe and effective. All right, so overall, vaccine-wise, we are making progress, but still lagging behind the rest of the region. Finger Lakes, that is, in our case, and again, compared to the state. And I'll be providing some more specific data shortly. But again, we are currently looking at some still emergency use situations. Moderna and J&J are still under EAU. Emergency use authorization, but they are in the process of getting full FDA approval, just similar to what we saw with Pfizer. And what we're hearing is we expect to see that within the next month to 3 months, hopefully. We will get full approval for both of those vaccines. We're also waiting for the approval for 12 and under. This is something that we believe will be a game changer for us when we do have a vaccine that we can offer to kids under 12. Currently, there is nothing available to protect them from COVID beyond different guidelines and recommendations and trying to keep them safe. So we're anticipating this approval to come, hopefully, again, within the next month to 3 months. Once it does come, we're going to be, offering that locally through our healthcare system, through our providers, through pharmacies, and obviously through our county-run clinics. So we are looking forward to that opportunity to provide that vaccine to children under 12 once it does get approved, hopefully shortly. All right, so one thing we've been talking a little bit about the last couple of weeks is third dose vaccinations. And again, this is for Moderna and Pfizer. There's been a recommendation by the CDC that those with certain compromised immune systems or those that are going through certain types of treatments are recommended to get a third dose of the vaccine. So we are offering that here at our county clinics. So folks do present with a list of the different criteria. And again, we refer people to the CDC to look at that and also to have a conversation with their healthcare provider. If they do believe they qualify and are under that recommendation for a third dose of vaccine, we're happy again to provide that. We are not requiring a doctor's note or any further verification per se at the county-run clinics, but we do have folks fill out an attestation form, similar to what we did when we started vaccine clinics back at the beginning of the year. So if you come to one of our clinics, you'll have to attest that you do meet the criteria for the third dose, but we are not requiring a doctor's note. But I would again encourage folks to talk to their healthcare provider if they do have any questions or concerns in regards to whether they qualify and or they're recommended for that third dose. Next thing is booster shots. So there's been quite a bit, obviously, in buzz around booster shots. And, in all fairness, we've been talking about this in many of these press briefings around the potential need. I mean, that's been a hot question of, are we going to need booster shots and when? So the answer is yes and soon. Bottom line, again, we've been talking about how we're obviously checking antibody levels and what level of protection folks have after they've been fully vaccinated. And at some point when that level drops down, or in this case, in addition, when a new variant comes along where the vaccine doesn't line up quite fully and you're seeing more breakthrough cases, which I've kind of gone through those numbers and we're seeing more of those, we need to, look to build up and booster up immunity. So currently, as I'm sure has already been out there, there are booster shot recommendations being considered with potentially starting September 20th. And again, these are for fully vaccinated folks with either Moderna or Pfizer at the moment. J&J is also looking at this, but they're a little further down the road as their approvals came a little bit behind Pfizer and Moderna. And again, they're currently looking at 6 to 8 months after being fully vaccinated would be the recommendation to go get that booster shot. So again, we are preparing for that also now. For all these folks who received their vaccine back in late December, January, February, starting at the end of September, they may be eligible to come and get a booster shot, obviously in the community here or one of our county clinics. With that being said, I just want to make it clear that, again, our focus truly remains on the unvaccinated. We can't stress the importance enough of getting more folks vaccinated, making that decision to come get that vaccine to protect themselves and their loved ones. So even through this fall, as boosters come in, we're still going to be focusing on those that are not vaccinated, again, whether they're adults and just haven't made that decision yet, or whether they're kids and the childhood vaccine gets approved. We're going to make an extra effort to focus in there, but also, provide those booster shots to those that are seeking that out. We continue to do vaccine clinics through the county. Again, I'd refer folks to GoHealth, our webpage. That's the place to register for those clinics. This week is the second round of our back to school vaccination clinics. We did them 3 weeks ago, offering the Pfizer vaccine, and my staff are back out going around both counties this week. So we are in the field and we're out vaccinating. Tomorrow we're going to be at Notre Dame High School in the morning and back at the health department in the afternoon. And on Thursday, we'll be up at Albion School and the Orleans County Health Department in the afternoon. So we are doing first shots there too. So if you want to stop out, I'd encourage everybody to, check out the link and sign up. We have plenty of vaccine available and we'd be happy to take care of your vaccine needs. We do expect clinic offerings to increase and expand as booster and childhood vaccines become available. So although, you may not see a ton of different available clinics on a weekly basis, we do expect to see those start to expand into more days, longer hours. Again, we're going to be flexing the scale and scope of what we're doing to meet the demand of the vaccine requests. All right, so I want to get into vaccination data a little bit here. So again, this is all information is always available. I'd encourage everybody to refer to the New York State Department of Health website. In addition, I would refer people to the Finger Lakes Regional Hub. Again, that provides nice local data when you're looking at the Finger Lakes information that's provided by our local Rochester Rio. So either one of them is going to provide people a good idea of where we're at as far as vaccinations in our counties. But in general, overall, if you look at New York State, currently 18 and older, we're at 76.8% with at least one dose, and 69.7% with completed series. And again, that's 18 and older, which is typically what the New York State data page looks like. When you look at the Finger Lakes hub, they actually run their data based on 12 and older, which is obviously anybody that's eligible currently to get the vaccine. And if you look at the 12 and older in the Finger Lakes, there's about 711,000 that have received at least one dose, or 68.2%, and completed series 61.2%. So drilling that down, again, I'm going to look at Genesee and Orleans County specifically here. We're down at, we have 30,078 in Genesee County that have at least one dose, or 60.2%. And then completed series, we're at 53.9. And again, that's 12 and older. And in Orleans County, we're at 18,999. Need one more to get to 19,000. I'm sure we hit that today with our clinics we're doing, but we're at about 55.4% of the population with at least one dose, and 48.6% with a completed dose, again, 12 and older. And the nice thing, if again you go to the Finger Lakes Hub website, there's a really good demographic breakdown by age group, by type of vaccine, by many different demographic bullet points. So you can really try to get an idea what's going on with who's been vaccinated, what are the percentages for the different age groups. So there is a lot of information there for those that are interested. All right, I'm going to flip over to guidance real quick here. So masking, that's been on everybody's mind lately, especially with schools starting back up. You know, and as I get into this, currently both Genesee and Orleans County are categorized by the CDC as a high level of community transmission. So again, folks can refer to that website if they want to follow along, and this is based on a 7-day rolling average of where we are with our transmission rates. And currently, again, we are both high. Pretty much the entire state is high. And if you look around the country, it's pretty much all red. And so when you look at that, that's really the per 100,000 case level. And by the CDC metrics anyways, how much virus is transmitting around in our communities. And again, we expect that to fluctuate, hopefully go down and stay down, but at the moment we are at the highest level. And in that, again, whether you're substantial or high transmission, the CDC recommends that anyone unvaccinated or vaccinated wear a mask indoors in crowded settings, even crowded outdoor settings. Again, that's the recommendation by the CDC. But just keep in mind, these are recommendations. There are no current local mandates in either Genesee or Orleans County around this. We do refer to the CDC, but we have not put in place any local mandates when it comes to masking. But we would strongly encourage folks, especially as we're in substantial and high levels, to adhere to the CDC recommendations and, try to reduce the spread as much as we can. And again, hopefully drop back down to the lower levels here shortly. All right, jumping over to schools, obviously a lot of discussion around there and a flurry of activity around schools in the last week and a half. Just so everybody's aware, I've been continuing to meet with school superintendents in both counties pretty much every week. We've talked all last year and a couple times throughout the summer. And again, going back the last month or so, we've been talking weekly, if not more than once a week, about reopening plans and how we're going to get kids back and get them back safely and hopefully have an in-person, safe, and productive year. So there has been a lot of conversations and a lot of sharing of information. And, we've been working with the schools to develop their reopening plans based on, it's kind of been evolving over the summer, right? The state DOH was going to be working on guidance. Then they said they're not coming out with guidance. Hence, we started our local development of plans to find out after 3 weeks, state ed was going to issue something. They issued something that referenced CDC basically. And then we found out now, obviously, Governor Hochul has come in and wants to have state DOH issue some guidance. So it's been confusing and frankly a little frustrating, especially for our superintendents who really worked hard in the lack of overall state guidance to come up with local plans that accommodated for CDC guidelines, but also took into account the variance and differences from district to district. So our recommendation to them when they started this was to use CDC guidance as the blueprint to develop their plans. But ultimately, the final decisions on what to include and how it's going to look in every school district, we obviously were leaving that up to the local district. And as we know, some districts already came out with their plans prior to the masking mandate. Some were waiting to see what happened with the new governor coming in. But either way, now obviously we do have a new statewide mandate for universal masking, which has been put in place by Governor Hochul. So this is, again, not a local mandate, but a one that has been put in place across the entire state for students, teachers, and staff and visitors that go into various school buildings. As I mentioned, this was frustrating for many of our schools who did work diligently to develop their local plans. I will say ultimately, though, the collective goal all along is by the schools, the superintendents, the boards, the local health department, is to have all students back to in-person learning this school year. And the goal is to do it with as few disruptions to that end as possible. So really that's been the focus, is to get the kids back, to get them back safely, and hopefully have them have a more typical year that they would normally experience. From the health department end, we're going to continue to advocate for local autonomy, which is what we've been doing here in Genesee and Orleans County throughout this pandemic. And we're going to continue to support our schools and the districts as we're able to. Another thing on the school side, again, you've probably heard, is the governor is exploring working on requirements for teachers and staff to become vaccinated or provide and submit to weekly testing. That is not in place currently. Although we do know that it is one of her initiatives and desires to do that if she does end up with the authority to make that happen. So again, we are working with the schools on testing. We do have funds to provide testing supplies to the schools. So we're in the process of getting that to them so that they will have that available in their schools. Again, whether it's for staff or students, to provide that on site. All right, one thing I do want to note, and again, this is just a side note on the universal masking. When you're looking at the school guidelines that are out there for back to school, with universal masking in place, one of the benefits of that is there will be very minimal quarantines for students in the upcoming year with universal masking in place. The guidelines per the CDC do not require or recommend quarantining exposures to positive cases if both the case and the other contacts were fully masked. So we're hoping that, now that there is a universal mask mandate that was put in place, that along with these kids wearing the mask in the school setting, that'll allow with a lot less quarantines. We dealt with a lot of those last year, unfortunately, and obviously that's very disruptive to the students' learning. And we're hopeful that, again, we can have better continuity of in-person learning now that mandate has been put in place. So hopefully a lot less quarantines this year, which should be welcomed hopefully by the families, and not having to have their students out, and then obviously the downstream effects of that. Again, I would refer people to CDC guidance, for K through 12, in addition to New York State Department of Health, Health and Safety Guide for 2022 school year. There's links available that people can really delve in and dig into the nuances of the guidance if they so choose. Real quick on the testing side, again, we continue to provide testing at both health departments on a weekly basis. I would refer you to the same website I did to sign up for vaccinations. We're only testing 1 day a week currently with limited time. We do have the Binox card, which is the antigen test. We are running out of the Abbott Now, which is the PCR test. So when that's gone, we will not have that available through the county clinics. We'll only have the antigen test available. I just want people to note that if you're looking for travel approval, if you're going out of country, or certain medical procedures require the PCR test, they will not accept an antigen test. So if you come to our clinic and we don't have the PCR, the Binox will not work. I'm just trying to avoid frustrated people who may take the time to come to us and then say, hey, I wanted the other tests. Well, unfortunately, the supply that we had from the state is drying up, and it does not look like they will be giving us any additional. So check ahead, check where you're going to see what type of tests they accept, and we're happy to provide the test if it meets your needs. And again, that's free of charge through the county. You just have to sign up for your appointment and show up. The other thing is, just as we move forward and as mandates and requirements come in, I'm just throwing this out here for our residents. It's going to probably become a little more challenging for folks to find testing. We are getting a lot of calls from businesses and employees of businesses who are now being required to get tested potentially on a weekly basis. And it's going to get harder and harder to find that type of access. So just putting that out there now. We do encourage people to look around. There is obviously still the testing location website at the New York State Department of Health. If you look up there, it will provide where current local testing can be done. But it is getting a little more scarce. There still are some local pharmacies doing it. I know some of our healthcare systems are doing it. Some of the providers may be doing it, but it's going to be harder. So just putting that out there now to think ahead and try to identify places where you'll be able to go test. And again, we will offer it as long as we can. All right. Last thing I want to touch on is home testing as I'm on that topic. Just so everybody's aware also, the health department, we're unable to verify the results from home tests. As you go into Walmart now, you go into Tops, to any of these pharmacies, you see displays with these home test kits. Again, we're not saying don't take them. Obviously, they are a quick check. I think a lot of people are doing that because they're not feeling quite right. They don't want to go find a test potentially, so they take it at home. The problem is we have no way to verify it. That's not an official test that's being done and reported to the state system. So we have no way to verify. So if you're looking for paperwork for an employer or insurance company, we can't do anything with that test. We need an official test that's done either through us or another official setting where it's an actual state-run and state-tracked test result. So again, if you're looking at it for some purpose of needing documentation verification, we can't do anything with the at-home test. Not that they're not fully accurate. Again, they're not as much as the PCR test, but they do give a pretty good indication on whether you're positive or negative. So if you do either a home test, you do need to follow that up potentially with another site if you do need it for other documentation. But if you take it and you're positive, you need to stay home, right? We don't want you out and about. I mean, you have a positive test result. We've seen a few of that where they've taken it positive, they ignore it and head on out in like normal business as usual. So again, if you take it, self-isolate, call your provider, healthcare provider, and potentially look at getting a confirmatory test. And again, we should be isolating for a minimum of 10 days or symptoms subsiding after 10 days. All right, as I wrap up, just a reminder, we are in the midst of a pandemic. We do have flu season coming. We do have, obviously, increase in cases going on. So I'm just going to wrap up my comments before we go to questions, that we need you to continue to follow, public health, universal public health precautions. We've been talking about them every year with flu season for the last 18 months with COVID. Avoid touching your eyes, your nose, your mouth, obviously with unwashed hands. Wash frequently, right? Important, stay 6 feet away from others, especially those that aren't in your close contact group. If you're sick, stay home. We do not want people going to work if you're sick, whether it's COVID or the flu or any other virus. We can keep our germs to ourselves, and we did obviously a very good job last year with very, very little flu spreading around, and we believe it's due to the fact of the enhanced precautions that everybody was using. Whether they used them on their own or they're part of the mandates, they did work. But moving forward, we really want to encourage people to get vaccinated. Now is a good time, plenty available. We're happy to service you at the county clinics or anywhere locally where you can get the vaccine. Flu shots are starting. You're starting to see those advertised right now at pharmacies. Get your flu shot, right? Let's make sure we're protected from all these different viruses so that we can obviously be as safe and healthy as we can moving into the winter months. All right, so that's it with my update. So I'm happy to open it up to questions as we get going with this. Please state your name and affiliation, and then obviously we're going to do our best to answer the questions, and/or we'll get back to you as soon as we can offline if need be. So with that, we'll turn it over to questions. And obviously they can be for me or Matt, Jack, or Shelley. We're all happy to answer questions. So,
Paul, this is Dan Fisher.
Hey Dan, how are you?
Yeah, I'm well. Thank you, sir. The question is, what should we make of the expiration dates that were shown on the little vaccination cards or on the cell phone apps that once people got their 2 Modernas or 2 Pfizers, they could get these cards. Some were electronic and they have expiration dates on them. Mm-hmm. Having gotten those in the spring, those expiration dates have already occurred or are about to. What should we make of that? Does that mean that the vaccination efficacy is no longer valid?
Yeah, so that's a great question, Dan, and obviously that's been an evolving discussion and evolving situation there as time has gone on. So you may recall when the vaccine started, we didn't have a lot of data and a lot of information. So part of the process is really checking and studying again, what are people's antibodies levels? How much efficacy is there of the vaccine over time in protecting against Delta? So when I got my card, my first shot, I think it was good for 3 months, right? So, at that point, it's kind of everybody, the big question in kind of late spring was what's going to happen when these cards expire? Do I have to get another shot? Am I not considered fully vaccinated? And then it went to 6 months and then the 9 months. And currently right now, I believe if you look at, if you did end up getting the Excelsior Pass, I think it's up to a year at the moment following your second dose. So again, they're looking at how well the vaccine's holding up over time. And obviously, as I went through kind of the booster approach, there is recommendations now for that booster shot. That doesn't mean you're not considered fully vaccinated, but to build up your antibodies to make sure you're as fully protected as you can be, that booster shot is going to be recommended again 6 to 8 months after you received your full vaccination. So don't pay quite as much detail to the date on the card. The important thing is you are fully vaccinated. You've received both shots. Your card will show that. Again, if you're coming in for your booster, we're going to want to see your card and to identify and verify that you are fully vaccinated. So make sure you have that handy. But again, those dates continue to get pushed out. But when they were written down, that was based on the best information we had at the time.
All right, last chance for a question. All right, Paul, looks like you did a great job with the update. I don't know if Shelley, if you have any parting words.
I just want to say a continued thank you to Paul, your leadership, and the dedication and commitment of your staff. It has really been a gargantuan effort that is not done yet, but we certainly appreciate you and your staff every single day here in the county. So thank you very much. And thank you for participating in this live town hall yet again for COVID vaccine. For Genesee and Orleans counties, thank you, and we appreciate it. Jack, Matt, Paul, thanks very much.